حياكم الله مشاهدينا من جديد، وطابت أيامكم ولحظاتكم وأوقاتكم بكل الخير. وفي هذه الإطلالة المتجددة من برنامج صحتك عبر قناة مجان الفضائية، وفي حديثنا لليوم عن أمراض السمنة والسكري مع الدكتور ديليب كومار، أخصائي باطنية وأمراض سكري. السلام عليكم دكتور.
وعليكم السلام.
دكتور، لاحظنا في الآونة الأخيرة خصوصا مع انتهاء جائحة كورونا أن في العديد من الأشخاص صاروا يصابوا بداء السكري، فحابين نعرف عن العلاقة ما بين حدوث داء كورونا وأيضا حدوث مرض السكري لهؤلاء الأشخاص. I was asking about that after coronavirus we have seen a lot of people developing diabetes for people who didn't have diabetes before. So we wanted to know about the relationship between coronavirus and diabetes.
Yeah, so it's a very good question, and it's a very good observation that during the COVID infection and after the COVID infection, the blood sugars were high for many patients, and we had a lot of new diabetic patients diagnosed because of this high blood sugar. Now, I would like to highlight here 2 points, that there are 2 subsets of patients. One, those who did not have any sugar problem or diabetes before the COVID infection, but because of this stress on the body, which I will just highlight you again in the later part. What do I mean by the stress? But because of this infection, the blood sugar went high, and we diagnosed many of them as new diabetic patients. Also, some patients who had pre-existing diabetes before the infection, their blood sugars were also very high. So in both the cases, it took us a lot of time to control the blood sugar. Now, any stress, what I mean is any kind of exertion on the body, say on the patient, like whether it is infection like COVID infection, which is a viral infection, all of us we know, we have gone through this pandemic, or it could be a surgical stress where the patient is undergoing surgery, it could be emotional, it could be mental. Any of this exertion on the body will raise the blood sugar. Now normally it comes down, but if the exertion or if the infection is too high, sometimes the blood sugar goes very high and it stays high. That's why we have got so many patients of high blood sugar and diagnosed as newly diabetes. We usually do one more test, which is called as HbA1c, which is an average of 3 months of sugar, which also tells us whether the patient had high blood sugar before the infection or not. So that's how we are able to diagnose whether the patient was before diabetic or not, or by history we come to know. And this infection or iltiab as we call in Arabic was very severe in some patients. Also, we had to give steroid injections to some of them to pull them out of this infection, and plus couple of other medications. So all of this steroids also contribute to raise the blood sugar. So the infection, the exertion, stress, steroids and other medication all probably are responsible for driving the blood sugar high. Some of them they kept on having high blood sugar in spite of recovering from the infection. So that's how, not only here, world over we have seen that a lot of patients they got converted into diabetic patients.
دكتور، أيضا لاحظنا في الفترة الأخيرة المتعلقة بمرض السكري الكثير من المراجعين يلجؤون إلى المحليات الصناعية، بحيث أنها ربما هو اعتقاد بأنها هي تعتبر آمنة لمرضى السكري، فما مدى صحة أو يعني هل هذه المحليات تكون فعلا آمنة لمرضى السكري؟ So doctor, we are asking about that. Recently we see a lot of products that are coming with not sugar but like other subsequences, but are they really safe for diabetic people?
Again, a very good question. Because we as doctors, when the patient comes to us and we find him to be diabetic and high blood sugar, our first advice is to reduce the sugar in diet, and one of the ways is by voluntarily taking food which has less sugar. There are options available in the market which we call as less sweeteners or low sweeteners. Most of them they have content aspartame, and there are other 2 or 3 more contents which are there which is less sweet. Now if you ask me frankly, I cannot 100% say they are safe. There is a risk always attached with this. So they may have side effects which we might be able to see after a couple of years, maybe not immediately. So we cannot guarantee it that they are 100% safe. So my advice would be that better to control your sugar by diet, by reducing the amount of sugar or carbohydrates you are taking in the diet. That is the first option. The second option which is available is that there are certain products which are made of herbal items, herbal things. So we can use that. A couple of them are available in the market, which are little more safer as compared to these chemical ones which we are using. So my advice is to either first go by diet, reduce your carbohydrate, exercise, maybe half an hour of walking, brisk walking, and still if somebody is very fond or he wants that sweet taste and doesn't want to go away with it, he can use one of these sweeteners, but I will advise that he should go for herbal as compared to these chemicals.
دكتور، الكثير من الأشخاص أيضا لديهم مخاوف من معجون الأسنان كونه يحتوي على مادة الفلورايد، لأن عندهم اعتقاد أن الفلورايد ممكن أن يضر الغدة الدرقية عندهم، فما مدى صحة هذا الكلام؟ Doctor, we are asking about that a lot of people are assuming that using toothpaste containing fluoride is harmful because they think that it might affect their thyroid gland. So is that true?
Most of the toothpaste, they contain fluoride because actually see, what we use toothpaste is on the tooth. Now for them it is needed, but the amount which is there is very, very less. So if you are brushing once or twice a day, it should not affect mostly. Yes, if somebody is brushing 4 or 5 times a day or excessively, then that may be an issue, but once or twice it should not be an issue.
دكتور، العديد من الأشخاص لديهم اعتقاد بأن الضوء ممكن يأثر على نشاط الغدة الصنوبرية، فمثلا يقول لك يعني لا، حاول إنك ما تنام وليت الحجرة مفتوح لأنه ممكن يأثر على نشاط الغدة الصنوبرية، فما مدى صحة هذا الكلام؟
Okay, this is another good question which you have asked me. See, what happens during the sleep, there is a hormone called melatonin. Now this hormone is secreted from the pineal gland, and it comes into the circulation, and this enables us to sleep comfortably. So this is one of the most important hormone when we sleep. Now what happens if a person is exposed to light and he wants to sleep? The production of this hormone goes down. So you can understand that his sleep will be disturbed, he will not be able to comfortably sleep. That's why we say that you should have a dark atmosphere, you should switch off your light when you are sleeping, because the production of this hormone goes up and this enables you to have a comfortable sleep. So that is the relation between pineal gland and light.
دكتور، أيضا من المهم أن نحن نتعرف على إيش هي الأشياء اللي نحن نمارسها روتينيا في حياتنا اليومية واللي تكون بالعادة مضرة لمرضى السكري، وإيش هي يعني الروتين اليومي اللي ممكن نمارسه وبالعكس أنه ممكن هو يفيدنا.
See, as we know that diabetes is, we all know, I think all of us have heard the word pandemic, which means across the globe. Similarly, diabetes is also like an epidemic. It's across the globe and it is rising, especially in this part of the world also, and everywhere. And the most important point to know is that half of these patients are not diagnosed. We have only diagnosed only 50% patients. Half of them, they don't know they have diabetes. So it's a very important medical disease which everybody in general and particularly in the society and community, everybody should have a knowledge on this. Recently, if you know the ministry guidelines, they have started screening from 35 years of age. Before it was 40. But because this is rising, in epidemic proportion, that's why they have lowered down by another 5 years. So now we start screening people from the age of 35 years, especially if somebody has a family history of diabetes, like mother, father, or first degree relative, people having heart disease or high blood pressure in the family or high cholesterol in the family, they should definitely go for screening. This is first important advice from my side. If suppose your blood sugar is found high, or your 3 months average HbA1c is found high, and we as a doctor diagnose you as a diabetic patient, then you should follow certain advices. Like, of course, first thing is the diet. You will need to change your diet. You will need to cut down on your sugars, your carbohydrate intake especially. Because normally what happens, our food for a normal person contains around 60 to 70% of carbohydrates, and the rest is fat and protein. This is our normal diet. But when you are diagnosed as a diabetic patient, you should cut down on your carbohydrates, especially if you are overweight or obese. You need to cut down to at least 40 or 30%. If you go to now it's it's an era of internet media. All the information is available. So once we diagnose, you get so many advices from so many places. Somebody might say you just cut down and make your carbohydrates zero. Now that is another important advice which I would like to highlight is, should not cut down to zero. You need some carbohydrates in the body. So come down to around 30% or 40%. You can take our help. You can sit with a dietitian, and there are so many people available to advise you on that. Along with that, so another important thing we need is the exercise. The best thing you can do is brisk walking, which is very easy. 30 minutes of brisk walking at least 5 times a week. If you can do that, that is around 150 minutes per week. That will help you a long way in reducing the weight. So brisk walk, what I mean by brisk walk is not the normal casual walk which we do. Most people are used to doing it after dinner. But the important thing to note is, what we want is not after dinner. Either it should be early morning or it should be in the evening before dinner. So you exercise half an hour, sweat yourself, and then you can rest and have your dinner. So at least 150 minutes of this aerobic exercise will help you a long way in reducing your weight, controlling your blood pressure, controlling your blood sugar, controlling your cholesterol levels, and in general you will feel more alert, more agile, more mobile. So these 2-3 things you should follow, and of course we are here as doctors to help you whenever you need any more advices.
شكرا لك دكتور، وشكرا على كل هذه النصائح القيمة. نتمنى أنها تكون قد وصلت إلى المشاهدين الأحبة. إذا كان معنا اليوم دكتور ديليب كومار، أخصائي باطني وأمراض سكري. شكرا لك لوجودك معنا اليوم.
Thank you so much for giving me this opportunity to share my thoughts on such an important topic. Thank you so much.
إذا مشاهدينا الأحبة كنتم معنا اليوم في موضوع حلقتنا اللي هو السكري والسمنة. نتمنى لكم طيب المشاهدة ونشوفكم دائما على خير بإذن الله تعالى.